A Shelby Township doctor has introduced a new vision-correcting procedure. That story from Elizabeth Gilardi.
How many fingers do you see? Can you see them now? What about now? In the case of Christina Kirkpatrick, she was extremely nearsighted. She couldn't even tell how many fingers were being held up in front of her face.
I've been wearing glasses since the 3rd grade, so you have to take that into context. And for regular glasses, without the super thin lenses they have nowadays, it would literally look like Coke bottles. They'd be this thick.
Her eyes were open to a new option when she came to see Dr. Goldstein.
I found out I couldn't get LASIK done, but then when I came to see Dr. Goldstein a couple years ago, he told me they were going to do this new surgery that people like me who can't have the LASIK done can have this other surgery, but it hadn't been FDA approved. That was 2 years ago.
LASIK is a procedure I do a lot of also, and LASIK surgery is an excellent procedure for correcting nearsightedness as well. LASIK works on the front of the eye, the area called the cornea. That's the same surface that a contact lens rests on. LASIK actually physically changes the shape of the eye, so that's the mechanism of action of LASIK, is to change the shape of the eye to correct nearsightedness, and that's a permanent change, for better or for worse. The good side of it is that once the change is made, it's a permanent change and patients enjoy good vision. The downside to that is if there are any problems with the LASIK, there's no way to reverse it. With the lens implant, we're actually placing the implant inside the eye in a space behind the iris, and if anything goes wrong with that, we can simply remove the lens implant and we haven't permanently changed the shape of the eye.
Dr. Goldstein was the first doctor in Michigan to perform this new procedure.
The Visian Implantable Contact Lens was originally designed for patients who were extremely nearsighted.
6 patients had this new procedure, and the results have been outstanding.
We actually are required to look at each of these patients an hour after their surgery just to make sure the implant's in good position and the pressure's good. 4 out of the 6 patients were better than 20/20. 1 was 20/20, and the 6th one was 20/30. So they all had excellent vision immediately after surgery. And all of these are patients who literally can't even count fingers within a few feet in front of their eyes without the surgery and without, contacts or glasses. So a very immediate, very dramatic result for these patients.
But Dr. Goldstein said the best part of the procedure is seeing the reaction of patients.
It's the most amazing feeling, to see the smile on her face. And to hear her saying just over and over again, oh my God, it really is the best feeling that you can have as a surgeon.
It's like a little kid on Christmas, pretty much. They get that nice new shiny fiery truck or bike they want, and that's how you feel. You can finally do things you couldn't do because you used to wear glasses and you always had to worry about your glasses breaking or falling off.
So if you're tired of wearing glasses or contact lenses and you're ready to see the world clearly again, then think about one of these vision correction procedures. I'm Elizabeth Gilardi for Shelby This Week.